This is Med School Radio, and today we're going to look at first aid, coronary blood supply. So before we do that, let's look at the terms we're going to be discussing. First, AMA, acute marginal artery. LAD, left anterior descending artery. LCA, left coronary artery. LCX, left circumflex artery. OMA, obtuse marginal artery. PDA, posterior descending artery. PT, pulmonary trunk. PV, pulmonary vein. And RCA, which is the right coronary artery. Okay, so let's get started. We're going to describe each of these and try to understand them a little bit more by talking them out. Okay, first the LAD. The LAD and its branches supply the anterior 2/3 of the interventricular septum and the anterolateral papillary muscle. The LAD supplies the anterior of the interventricular septum, the anterolateral papillary muscle, and the anterior surface of the left ventricle, which is most commonly occluded. Next, the PDA, which is the posterior descending artery, supplies the AV node, and this is dependent on dominance, which we will read a little bit later. The posterior 1/3 of the interventricular septum, the posterior 2/3 walls of the ventricles, and posterior medial papillary muscle. The right or acute marginal artery supplies the right ventricle. And the RCA, or the right coronary artery, supplies the SA node. And the blood supply is independent of dominance. An infarct may cause nodal dysfunction, bradycardia, or heart block. So now let's discuss dominance. It's written here in first aid. Dominance. Firstly, right dominant circulation, which is 85%. In this case, the PDA, or posterior descending artery, arises from the RCA, or right coronary artery. In left dominant circulation, which is 8%, the PDA arises from the LCX. And remember, the LCX is the left circumflex artery. Next, with codominant circulation, which is 7%, the PDA arises from both the LCX and the RCA. And lastly, the thing to remember here in first aid, coronary blood flow peaks in early diastole. Thank you very much.